Question 1. A social worker is conducting an initial intake with a new client who discloses they are experiencing suicidal ideation with a specific plan and means, but denies intent to act on it. What is the social worker's first action? A. Refer the client to an outpatient therapy group for depression. B. Develop a comprehensive safety plan with the client immediately. C. Document the client's statements in the case record. D. Contact the client's emergency contact for support. Answer: B. Develop a comprehensive safety plan with the client immediately. This question assesses understanding of crisis intervention and safety planning when a client expresses suicidal ideation. The keyword first indicates the most immediate and critical action. Even without immediate intent, the presence of a specific plan and means necessitates a direct, proactive response to ensure client safety. Developing a safety plan helps the client identify triggers, coping strategies, and support systems to use in times of crisis, which is a foundational intervention in such situations. For example, the plan might include identifying friends to call, safe places to go, and removing lethal means. Remember, safety first, always prioritize immediate client safety through active planning. Question 2. A social worker receives a subpoena for a client's records. The client has not provided consent for disclosure. What is the best next step for the social worker? A. Release the records as requested by the subpoena. B. Immediately notify the client of the subpoena and seek their informed consent. C. Refuse to release the records due to confidentiality. D. Consult with a supervisor on how to proceed without informing the client. Answer: B. Immediately notify the client of the subpoena and seek their informed consent. This question tests ethical obligations regarding client confidentiality and legal demands. The phrase "best next step" points to the most ethically sound and legally appropriate action. While a subpoena is a legal order, client confidentiality is paramount, and the social worker has an ethical duty to protect it until legally compelled or client consent is given. Informing the client allows them to understand the situation, consult their own attorney, and make an informed decision about waiving privilege, which respects their autonomy. For instance, the client might choose to challenge the subpoena or provide limited consent. Always remember to involve the client and seek their consent before releasing any confidential information, even when faced with a subpoena. Question 3. A social worker is working with an adolescent client who consistently arrives late for sessions and often forgets to complete agreed-upon tasks. What is the most appropriate initial approach for the social worker? A. Terminate services due to lack of client engagement. B. Impose consequences for lateness and incomplete tasks. C. Explore the reasons behind the client's lateness and forgetfulness. D. Provide the client with a detailed schedule and task checklist. Answer: C. Explore the reasons behind the client's lateness and forgetfulness. This question focuses on engagement strategies and understanding client behavior from a strengths-based and person-in-environment perspective. The keyword "most appropriate initial approach" directs you to a foundational social work principle. Before assuming noncompliance or implementing behavioral interventions, it is crucial to understand the underlying factors contributing to the client's challenges, such as transportation issues, executive function difficulties, or resistance due to developmental stage. This exploratory approach builds rapport and identifies potential barriers to treatment. For example, the client might be late because they are caring for younger siblings before school. Always prioritize understanding the client's unique circumstances before moving to intervention. Question 4. A client, who has been attending therapy for 6 months, Informs the social worker that they plan to move out of state next month and will need to terminate services. What is the social worker's first responsibility? A. Begin the referral process to a new social worker in the client's new location. B. Process the final billing statements and close the client's file. C. Review the client's progress and discuss termination feelings and tasks. D. Schedule one last intense therapy session to resolve all remaining issues. Answer: C. Review the client's progress and discuss termination feelings and tasks. This question addresses the ethical and clinical considerations of the termination phase of treatment. The word first highlights the immediate priority in managing the end of the therapeutic relationship. Before focusing on administrative tasks or referrals, the social worker must address the client's emotional response to termination, review their achievements, and identify any remaining needs or concerns. This process validates the client's experience, reinforces their growth, and helps them transition successfully. For example, discussing feelings about ending therapy can help prevent feelings of abandonment. Remember, a thoughtful termination process is a vital part of effective social work practice, prioritizing the client's emotional well-being. Question 5. A social worker is meeting with a family where a 10-year-old child is refusing to attend school. The parents are frustrated and have tried various punishments without success. What is the best initial intervention for the social worker? A. Recommend family therapy to address communication issues. B. Refer the child for an individual psychological assessment. C. Meet with the child alone to understand their perspective on school refusal. D. Educate the parents on positive reinforcement techniques. Answer: C. Meet with the child alone to understand their perspective on school refusal. This question focuses on assessment and engagement with children in family systems. The term best initial intervention emphasizes the most effective starting point. While family dynamics and parental techniques are important, directly engaging with the child is crucial for understanding the specific reasons behind their school refusal, which could range from bullying to anxiety or learning difficulties. Gaining the child's perspective fosters trust and provides invaluable information that informs subsequent interventions, rather than making assumptions. For instance, the child might reveal they are being teased for their clothes. Always prioritize hearing directly from the person experiencing the problem, especially a child, to ensure interventions are well targeted. Question 6. A social worker observes a colleague consistently coming to work late, appearing disheveled, and making frequent errors in documentation. The colleague has also mentioned personal stressors recently. What is the social worker's first ethical obligation? A. Report the colleague to the state licensing board immediately. B. Speak directly with the colleague about their observations and concerns. C. Document the colleague's behavior in detail over several weeks. D. Offer to take on some of the colleague's caseload to reduce their burden. Answer: B. Speak directly with the colleague about their observations and concerns. This question assesses ethical responsibility when a colleague's impairment is suspected. The keyword first points to the initial, least intrusive, and most direct ethical action. Social workers have a responsibility to address ethical misconduct or impairment in colleagues, but the first step is typically to address the issue directly with the colleague, if possible and appropriate, out of respect and to allow for self-correction. This approach often resolves issues without needing formal reporting, which should be reserved for situations where direct intervention is ineffective or the client's safety is immediately at risk. For example, the colleague might be struggling with a family illness and be unaware of the impact on their work. Always try direct communication before escalating concerns about a colleague's competence. Question 7. A client with a history of severe anxiety is experiencing an acute panic attack during a therapy session. What is the most appropriate immediate action for the social worker? A. Discuss the underlying causes of the panic attack. B. Encourage the client to breathe deeply and focus on calming techniques. C. Call emergency services for immediate medical intervention. D. Terminate the session and reschedule when the client is calmer. Answer B. Encourage the client to breathe deeply and focus on calming techniques. This question assesses crisis intervention skills for acute anxiety. The phrase "most appropriate immediate action" requires a focus on de-escalation and stabilization. During an acute panic attack, the client's physiological response is overwhelming, and cognitive processing is difficult. Therefore, direct calming techniques are essential. Helping the client regulate their breathing and grounding themselves helps reduce the physical symptoms of anxiety, allowing them to regain a sense of control. For example, guiding them through a 4-7-8 breathing exercise can significantly reduce distress. Remember, during an acute crisis, the primary goal is to stabilize the client before attempting to explore deeper issues. Question 8. A new client presents with symptoms consistent with major depressive disorder and reports significant impairment in daily functioning. What is the social worker's best initial step in the assessment process? A. Develop a detailed treatment plan focused on cognitive restructuring. B. Administer a standardized depression screening tool to confirm diagnosis. C. Conduct a comprehensive biopsychosocial spiritual assessment. D. Refer the client immediately to a psychiatrist for medication management. Answer C. Conduct a comprehensive biopsychosocial spiritual assessment. This question tests the foundational step of a thorough social work assessment. The phrase "best initial step" indicates the most comprehensive and ethical starting point. While a client's reported symptoms might point to a specific disorder, social work practice requires a holistic understanding of the client within their environment, considering biological, psychological, social, and spiritual factors. This broad assessment ensures all contributing factors are identified, leading to a more individualized and effective treatment plan. For instance, the client's depression might be linked to social isolation or economic hardship, not just internal psychological factors. Always begin with a comprehensive assessment to gain a full picture of the client's situation. Question 9. A social worker is facilitating a support group for survivors of domestic violence. One group member consistently monopolizes the discussion and often offers unsolicited, unhelpful advice to others. What is the most appropriate action for the social worker? A. Ask the group member to leave the group due to disruptive behavior. B. Allow the behavior to continue, as it is important for members to express themselves freely. C. Address the behavior directly and set boundaries during the group session. D. Discuss the behavior privately with the group member after the session. Answer C. Address the behavior directly and set boundaries during the group session. This question assesses group facilitation skills and the management of challenging group dynamics. The most appropriate action requires balancing individual expression with group cohesion and safety. When a member's behavior disrupts the group process, it's essential for the facilitator to address it directly but constructively within the group, as this models appropriate boundaries for everyone and maintains the group's therapeutic purpose. Waiting until after the session can invalidate other members' experiences and allow the behavior to continue. For example, the social worker might say, "I appreciate your contributions, but let's make sure everyone has a chance to share." Always manage disruptive group behaviors directly and constructively within the group setting. Question 10. A social worker learns that a client, who is a minor, has been physically abused by a parent. The client expresses fear and asks the social worker not to tell anyone. What is the social worker's next step? A. Respect the client's wishes and maintain confidentiality. B. Document the disclosure and monitor the situation for further abuse. C. Inform the client that mandated reporting laws require the social worker to report the abuse. D. Confront the parent about the alleged abuse to gather more information. Answer: C. Inform the client that mandated reporting laws require the social worker to report the abuse. This question tests knowledge of mandated reporting obligations and ethical dilemmas. The keyword next highlights the immediate follow-up to the disclosure of child abuse. Social workers are mandated reporters, meaning they are legally required to report suspected child abuse to the appropriate authorities, regardless of the child's wishes for confidentiality. It is crucial to inform the client of this obligation gently but clearly, explaining the social worker's role and the legal requirements, which helps maintain trust even when confidentiality cannot be upheld. For example, explaining that the report is made to ensure their safety. Remember, mandated reporting takes precedence over confidentiality when child abuse is suspected. Question 11. A client with a history of substance use disorder has recently relapsed after several months of sobriety. The client expresses feelings of shame and hopelessness. What is the social worker's best immediate response? A. Express disappointment in the client's relapse and reinforce the consequences. B. Focus on identifying the triggers that led to the relapse. C. Validate the client's feelings and reinforce their progress and capacity for recovery. D. Refer the client immediately to an inpatient treatment program. Answer: C. Validate the client's feelings and reinforce their progress and capacity for recovery. This question emphasizes a strengths-based, non-judgmental approach in social work practice, particularly in recovery. The phrase "best immediate response" points to the most supportive and therapeutic action. In moments of relapse, clients often feel immense guilt and despair. Therefore, the social worker's role is to offer empathy, validate their difficult emotions, and remind them of their past successes and inherent resilience. This approach helps rebuild their self-efficacy and encourages continued engagement in treatment. For example, acknowledging their shame and reminding them of the months they maintained sobriety. Always lead with empathy and reinforcement of strengths, especially after a setback in recovery. Question 12. A social worker is conducting a home visit and observes unsanitary living conditions, but no immediate signs of neglect or abuse towards the children living there. What is the social worker's most appropriate action? A. Immediately report the family to Child Protective Services. B. Offer resources and education on home organization and hygiene. C. Document the observations and schedule a follow-up visit. D. Inform the parents that their children may be removed if conditions do not improve. Answer: B. Offer resources and education on home organization and hygiene. This question tests the social worker's role in supporting families while respecting their autonomy and avoiding punitive approaches. The term "most appropriate action" emphasizes a supportive, educational, and least restrictive intervention. While unsanitary conditions are a concern, without direct evidence of neglect or abuse, the social worker's role is to offer assistance and empower the family to make improvements. Providing resources and education is a supportive way to address the issue and build trust, rather than immediately involving authorities, which can be stigmatizing. For example, offering information on community cleanup programs or health department services. Always start with supportive and empowering interventions before considering more intrusive measures. Question 13. A social worker is preparing to terminate services with a client who has made significant progress and achieved their treatment goals. The client expresses sadness about ending therapy and asks if they can occasionally call the social worker for check-ins. What is the best response? A. Agree to occasional check-ins to maintain rapport and support. B. Explain the importance of maintaining professional boundaries and refer to post-termination resources. C. Suggest continuing therapy indefinitely, as the client clearly still needs support. D. Recommend a brief, informal social relationship to ease the transition. Answer B. Explain the importance of maintaining professional boundaries and refer to post-termination resources. This question assesses understanding of professional boundaries and the termination process. The word best highlights the most ethical and professional response. While it is natural for clients to feel sadness during termination, it is critical for the social worker to maintain clear professional boundaries to protect the client, the social worker, and the integrity of the profession. Agreeing to check-ins blurs these boundaries and can hinder the client's autonomy and ability to function independently. Instead, the social worker should reinforce the client's strengths and provide appropriate referrals for ongoing support if needed. For instance, suggesting support groups or community resources. Always uphold professional boundaries and empower clients for independent functioning after termination. Question 14. A client reports that their partner has recently become verbally abusive and is increasingly controlling. The client expresses fear for their safety but is hesitant to leave the relationship due to financial dependence. What is the social worker's first priority? A. Help the client develop a detailed financial independence plan. B. Discuss legal options for obtaining a restraining order. C. Assess the client's immediate safety and develop a safety plan. D. Encourage the client to confront their partner about the abuse. Answer C. Assess the client's immediate safety and develop a safety plan. This question addresses crisis intervention and safety planning in situations involving domestic violence. The keyword first indicates the most critical and immediate action. While financial independence is an important long-term goal, the client's expressed fear for their safety necessitates an immediate assessment of risk and the development of a safety plan. This plan might include identifying safe places, emergency contacts, and a clear exit strategy, prioritizing the client's physical and emotional well-being. For example, discussing where they could go if the abuse escalates. Always prioritize immediate safety assessment and planning when a client expresses fear due to abuse. Question 15. A social worker is mandated to report suspected elder abuse to Adult Protective Services, APS. The social worker has gathered sufficient information to make the report. What is the next step after making the report? A. Inform the alleged abuser of the report and the investigation. B. Continue to provide services to the elder client as appropriate. C. Discuss the details of the report with family members. D. Close the client's case now that the report has been made. Answer B. Continue to provide services to the elder client as appropriate. This question tests understanding of mandated reporting procedures and ongoing client care. The term next step refers to the action immediately following the report. Making a mandated report does not end the social worker's responsibility to the client. The social worker should continue to offer support, advocacy, and services, as the client will likely need ongoing assistance throughout the investigation and beyond. Maintaining the therapeutic relationship is crucial, as the reporting process can be distressing for the client. For example, providing emotional support during the APS investigation. Remember that making a report is just one step. Ongoing client support remains essential. Question 16. A social worker is facilitating a psychoeducational group for parents of children with ADHD. A parent asks for specific advice on how to discipline their child who is consistently defiant. What is the best response from the social worker? A. Provide a detailed, step-by-step discipline strategy based on current research. B. Encourage other group members to share their successful discipline strategies. C. Explain general principles of behavior management and encourage the parent to apply them. D. Refer the parent to an individual family therapist for personalized guidance. Answer: C. Explain general principles of behavior management and encourage the parent to apply them. This question focuses on the appropriate role of a social worker in a psychoeducational group setting. The word best indicates the most suitable approach for group work. While individual advice can be helpful, in a group setting, it's more effective and ethical to teach general principles and tools that empower all members to apply them to their unique situations, rather than giving specific, individualized advice which is best suited for individual therapy. This approach fosters independence and encourages peer learning within the group's scope. For example, discussing positive reinforcement or clear consequence setting. Always provide general principles and empower group members to adapt them rather than giving specific individualized advice. Question 17. A client with a long history of homelessness and mental illness expresses a desire to secure permanent housing. What is the social worker's most appropriate initial intervention? A. Refer the client to a vocational training program. B. Connect the client with resources for housing assistance and support them in the application process. C. Provide the client with a list of available housing shelters. D. Focus on intensive individual therapy to address their mental health symptoms first. Answer: B. Connect the client with resources for housing assistance and support them in the application process. This question emphasizes client-centered practice and addressing immediate needs. The phrase "most appropriate initial intervention" highlights focusing on the client's stated primary goal. While vocational training and mental health therapy are important, directly addressing the client's expressed desire for housing aligns with the social work principle of self-determination and provides a foundation for addressing other issues. Connecting them with housing resources and actively assisting with applications is a practical, empowering step towards stability. For instance, helping them complete paperwork for subsidized housing. Always start by addressing the client's most pressing and stated needs, as this builds trust and provides a foundation for further work. Question 18. A social worker is preparing to conduct an assessment with a client from a different cultural background. What is the best approach to ensure cultural competence during the initial meeting? A. Assume cultural universalism and focus solely on the client's individual symptoms. B. Rely on stereotypes about the client's culture to anticipate their needs. C. Research the client's cultural background thoroughly beforehand and ask open-ended questions to learn about their unique experiences. D. Ask the client to explain all aspects of their culture relevant to therapy. Answer: C. Research the client's cultural background thoroughly beforehand and ask open-ended questions to learn about their unique experiences. This question tests the application of cultural competence in practice. The word best highlights the most effective and respectful strategy. Culturally competent practice involves both learning general information about different cultures, research beforehand, and recognizing individual variations within cultures, asking open-ended questions. This dual approach helps the social worker avoid assumptions, appreciate diversity, and tailor interventions respectfully, demonstrating a commitment to humility and individualized care. For instance, understanding general family structures in their culture, then asking how their family operates. Always engage in ongoing learning about cultures while prioritizing the client's unique perspective through open dialogue. Question 19. A social worker is working with a client who is experiencing significant grief after the recent death of a spouse. The client frequently expresses feelings of guilt and regret. What is the most helpful initial intervention? A. Challenge the client's irrational guilt and encourage them to move on. B. Focus on exploring the client's childhood experiences to find the root of the guilt. C. Validate the client's feelings of guilt and normalize the complexity of grief. D. Prescribe medication to alleviate the client's intense emotional pain. Answer: C. Validate the client's feelings of guilt and normalize the complexity of grief. This question assesses understanding of grief counseling and empathetic responses. The phrase, most helpful initial intervention, points to a supportive and client-centered approach. During acute grief, feelings of guilt and regret are common and often part of the normal grieving process, rather than irrational thoughts to be challenged. Validating these complex emotions and normalizing them helps the client feel understood and less isolated, fostering a safe space for processing their loss. For example, acknowledging their guilt and explaining that many grieving people experience similar feelings. Always prioritize empathy and validation in the initial stages of grief to build rapport and facilitate healing. Question 20. A social worker conducting a home visit observes multiple prescription medication bottles left unsecured and within reach of young children. The parent states they often forget to put them away. What is the social worker's first action? A. Immediately report the family to Child Protective Services for neglect. B. Educate the parent on safe medication storage and offer practical solutions. C. Document the observation and schedule a follow-up visit to ensure compliance. D. Remove the medications from the home and dispose of them safely. Answer: B. Educate the parent on safe medication storage and offer practical solutions. This question addresses the social worker's role in promoting child safety through education and support. The keyword first indicates the immediate, least intrusive, and most empowering action. While the situation presents a safety risk, it often stems from forgetfulness rather than intentional neglect. Providing immediate education on safe storage practices and offering practical solutions, e.g., child-proof locks, higher shelves, empowers the parent to correct the issue and prevents potential harm. For example, showing them how to use a child-resistant cap. Always prioritize direct education and support to address preventable safety risks before escalating to more formal interventions like reporting. Question 21. A client reports experiencing flashbacks, nightmares, and severe anxiety after witnessing a traumatic event 6 weeks ago. What is the social worker's best initial approach? A. Immediately begin eye movement desensitization and reprocessing, EMDR, therapy. B. Focus on developing coping skills and providing psychoeducation about trauma responses. C. Encourage the client to suppress their memories of the event. D. Refer the client to an inpatient facility for intensive trauma treatment. Answer: B. Focus on developing coping skills and providing psychoeducation about trauma responses. This question assesses appropriate initial interventions for acute trauma symptoms. The phrase best initial approach highlights the importance of stabilization and symptom management before deeper processing. While EMDR and intensive therapy are valuable, the immediate goal is to help the client manage their acute symptoms, understand that their reactions are normal responses to trauma, and develop immediate coping strategies. This helps to stabilize them and build a foundation for more intensive trauma work later. For example, teaching grounding techniques for flashbacks. Always prioritize stabilization, psychoeducation, and coping skill development in the initial stages of acute trauma response. Question 22. A social worker in a community mental health clinic is approached by a former client at a local grocery store. The former client attempts to engage in personal conversation and asks about the social worker's family. What is the most appropriate response? A. Engage in a brief, friendly conversation to maintain rapport. B. Politely acknowledge the client, stating that personal discussions are not appropriate outside of a professional setting, and excuse oneself. C. Ignore the client to avoid any interaction. D. Refer the client back to the clinic if they wish to discuss anything. Answer B. Politely acknowledge the client, stating that personal discussions are not appropriate outside of a professional setting, and excuse oneself. This question examines ethical boundaries in social work practice, especially with former clients. The phrase "most appropriate response" emphasizes maintaining professional distance while being respectful. It is crucial to avoid dual relationships or interactions that blur the professional boundary, even after termination. Acknowledging the client politely but firmly reiterating the professional boundary protects both parties and prevents misunderstandings, without being rude or dismissive. For instance, a brief "It's good to see you, but I can't discuss personal matters here. Please call the clinic if you need anything." Always maintain professional boundaries discreetly and respectfully when encountering clients outside of the professional setting. Question 23. A 16-year-old client, receiving individual therapy for anxiety, confides in the social worker that they are sexually active but have not discussed this with their parents. The client lives in a state where minors can consent to reproductive health services. What is the social worker's next step? A. Immediately inform the client's parents due to their minor status. B. Advise the client to disclose this information to their parents. C. Explore the client's understanding of safe sex practices and reproductive health options. D. Document the disclosure and take no further action as it is confidential. Answer C. Explore the client's understanding of safe sex practices and reproductive health options. This question addresses confidentiality with minors, adolescent development, and harm reduction. The word next highlights the social worker's ethical and practical responsibility. Given that the client can consent to reproductive health services in their state and has disclosed sexual activity, the social worker's primary concern shifts to ensuring the client's health and safety. Exploring their knowledge of safe sex and available resources is a proactive, empowering, and confidential way to promote their well-being, respecting their autonomy within the legal framework. For example, discussing contraception or STI prevention. Always prioritize the minor client's health and safety by providing relevant information and resources when they disclose sexual activity and have legal autonomy. Question 24. A social worker is working with a client who consistently expresses feelings of low self-worth and criticizes their own achievements despite objective success. What is the best long-term intervention approach? A. Encourage the client to avoid situations where they might feel inadequate. B. Challenge the client's negative self-talk and help them reframe cognitive distortions. C. Provide extensive praise and compliments to boost their self-esteem. D. Focus on uncovering early childhood trauma as the sole cause of low self-worth. Answer B. Challenge the client's negative self-talk and help them reframe cognitive distortions. This question focuses on cognitive behavioral interventions for self-esteem issues. The phrase "best long-term intervention approach" points to strategies that address the core thought patterns contributing to the problem. Low self-worth often stems from ingrained negative self-talk and distorted thinking patterns. Helping clients identify and reframe these cognitive distortions empowers them to change their internal narrative, leading to sustainable improvements in self-esteem. For instance, helping them identify all-or-nothing thinking or catastrophizing. Always aim to equip clients with tools to challenge their own negative thought patterns for lasting change. Question 25. A social worker receives a phone call from a concerned family member asking for information about their adult sibling, who is a client. The family member states they are worried about the client's mental health. What is the social worker's first response? A. Share general information about the client's progress, maintaining confidentiality regarding specific details. B. State that confidentiality prevents the social worker from confirming or denying that the individual is a client. C. Advise the family member to contact emergency services if they believe the client is in immediate danger. D. Ask the family member for a written release of information signed by the client. Answer B. State that confidentiality prevents the social worker from confirming or denying that the individual is a client. This question assesses the fundamental ethical principle of confidentiality. The word first emphasizes the immediate and absolute protection of client information. Even confirming or denying that someone is a client is a breach of confidentiality unless the client has provided explicit consent. The social worker must uphold this boundary to protect the client's privacy and autonomy, explaining clearly that no information can be disclosed. For example, a response like, "Due to strict confidentiality policies, I cannot confirm or deny whether an individual is receiving services here." Always prioritize maintaining strict confidentiality, even by not acknowledging client status, unless there is a valid release or immediate threat of harm.